Michael was a successful tech entrepreneur who discovered meditation during a stressful period. It helped initially, so he decided more would be better. He quit his job, moved to a meditation center, and began practicing 8 hours a day with minimal guidance. Within 3 months, he was experiencing severe panic attacks, dissociation so intense he felt like he was watching his life through a screen, and intrusive, disturbing thoughts he couldn't control. He ended up hospitalized. His doctors had never seen meditation-induced psychosis before and didn't know how to treat it. Michael's story isn't unique. Dr. Willoughby Britton at Brown University has documented hundreds of cases of serious adverse effects from meditation, including depersonalization, existential terror, traumatic re-experiencing, and in rare cases, complete psychological breakdowns requiring psychiatric intervention. This isn't anti-meditation propaganda. This is a necessary conversation that the meditation industry doesn't want to have, but that Tibetan masters have been warning about for centuries. If you want to understand the real risks of meditation, how to recognize warning signs, and how to practice safely and effectively, subscribe right now and turn on notifications. This might be the most important video about meditation you ever watch, because it could prevent serious harm while helping you practice in a way that's actually beneficial. This is about informed practice, not blind enthusiasm. Before we explore this crucial topic, I want to be completely transparent with you. This video was created with the help of artificial intelligence for narration and visual elements, but it contains 100% rigorous research from both traditional Tibetan sources and contemporary scientific studies on meditation-related adverse effects. My commitment is to present balanced, honest information that respects both the profound benefits and the real risks of contemplative practice. Let's start with what modern research has discovered. For decades, meditation was presented in the West as universally beneficial with no downsides. More meditation is better. Everyone should meditate. It's the solution to all problems. This narrative was appealing and marketable, but it wasn't accurate. Dr. Willoughby Britton, a neuroscientist and clinical psychologist at Brown University, became interested in adverse effects when several of her research participants and students reported disturbing experiences during and after meditation retreats. Experiences that weren't supposed to happen according to the popular narrative. She launched the Varieties of Contemplative Experience study, systematically interviewing meditation practitioners, teachers, and clinicians about negative effects. What she found was striking. Approximately 25% of regular meditators report significant adverse effects at some point in their practice. These aren't just mild discomfort or boredom. These are serious psychological difficulties, including anxiety and panic that's worse than before meditation, depression and suicidal ideation, dissociation and depersonalization, where you feel disconnected from yourself and reality, re-experiencing of trauma and overwhelming emotions, cognitive impairments like difficulty concentrating or making decisions, perceptual changes including visual and auditory distortions, loss of sense of self that's terrifying rather than liberating, and in rare cases, psychotic episodes. A study published in PLOS One in 2017 found that over 60% of meditation practitioners reported at least one negative effect, though most were relatively mild, but around 14% reported effects that were significantly distressing and impairing. Another study in 2020 found that adverse effects were more common in people who did intensive retreat practice, practiced for longer periods, or had pre-existing mental health conditions. This doesn't mean meditation is bad or dangerous for everyone. It means meditation is a powerful intervention that, like any powerful intervention, can have side effects and risks, especially when practiced incorrectly or by vulnerable populations without proper support. The meditation industry, which is now worth billions of dollars, has largely ignored this research. Apps and studios continue to present meditation as risk-free and universally beneficial. But responsible teachers and traditions, including Tibetan Buddhism, have always known and taught about these dangers. The problem is these warnings were often kept within traditional training contexts and didn't make it into the westernized, commercialized versions of meditation. Have you ever experienced negative effects from meditation, or felt pressure to keep practicing even when it wasn't helping? Share in the comments. This conversation needs to happen openly. Now let's look at what Tibetan Buddhism has taught about the dangers of meditation for over 1,000 years. Traditional texts are filled with warnings. The Lamrim, the graduated path to enlightenment, emphasizes that practices must be done in proper sequence with proper preparation. Advanced practices without foundation are not just ineffective, they're dangerous. Dzogchen and Mahamudra, the highest teachings, are traditionally only given to students who have completed years of preliminary practices, precisely because trying to practice these without preparation can lead to serious problems. Tibetan masters warn about several specific dangers. Lung disorder, which we mentioned in the previous video, is a condition where meditation, especially intensive breath work or concentration practices done incorrectly, disturbs the subtle energy system. Symptoms include anxiety, agitation, insomnia, heart palpitations, digestive problems, mental instability, and feeling ungrounded or spaced out. This maps directly onto what Western psychology calls depersonalization and anxiety disorders. Traditional Tibetan medicine has specific treatments for lung disorders caused by meditation, including herbs, dietary changes, less intensive practice, and more grounding activities. The fact that they have treatments means they've been dealing with this problem for centuries. Another danger warned about is spiritual pride, or what's sometimes called Zen sickness. This happens when someone has genuine meditative experiences, altered states, feelings of bliss or insight, and mistakes these for full enlightenment. They become arrogant, dismissive of others, convinced they've achieved something special. This can lead to harmful behavior, exploitation of students if they become teachers, and actually derail further genuine progress. Tibetan teachers traditionally deflate these experiences quickly, reminding students that temporary states are not realization and that genuine attainment is accompanied by increased humility and compassion, not arrogance. There's also warning about practicing beyond your capacity. It's like trying to lift a weight that's too heavy. You'll injure yourself. If you're emotionally fragile or dealing with trauma, intensive meditation can overwhelm your system. If you have certain mental health conditions, particularly psychotic disorders or dissociative disorders, meditation can exacerbate symptoms. Traditional teachers would assess students carefully and give individualized guidance. Some people would be told to do more study and less meditation. Others might be given specific grounding practices. The idea of one-size-fits-all meditation is foreign to authentic traditions. Perhaps most importantly, Tibetan Buddhism teaches that meditation without ethics, without community, without a qualified teacher, and without study is not just ineffective but potentially harmful. Meditation isn't just sitting quietly. It's part of a complete path that includes moral conduct, wisdom teachings, and guidance. Trying to meditate while living an unethical life, or while fundamentally misunderstanding the teachings, can lead to what's called spiritual materialism, using practice to inflate ego rather than transcend it, or spiritual bypassing, using meditation to avoid dealing with real psychological and relational problems. If these warnings from ancient traditions align with modern research, hit the like button. This convergence validates both sources of knowledge. Let's talk about specific problems and how they manifest. Dissociation and depersonalization are among the most commonly reported adverse effects. During meditation, especially practices that emphasize observing thoughts and sensations as objects, some people begin to feel disconnected from their experience. This can progress to feeling like you're watching your life from outside, like you're not real, like the world isn't real. For some people, this is temporary and part of deepening insight. For others, it becomes chronic and distressing. You lose the ability to feel connected to yourself, to others, to your life. Everything feels flat, distant, meaningless. The difference between healthy detachment and pathological dissociation is crucial. Healthy detachment in Buddhism means you're less identified with thoughts and emotions, less controlled by reactivity, but you're still present, engaged, compassionate, and functional. Pathological dissociation means you've disconnected from yourself as a defense mechanism, and it impairs your ability to live. If meditation is making you feel spaced out, disconnected, unable to feel emotions, or unable to engage with your life, that's not enlightenment. That's dissociation, and you need to stop or modify your practice immediately. Trauma re-experiencing is another serious risk. Meditation asks you to pay attention to present moment experience without distraction. For trauma survivors, present moment experience often includes body sensations, emotions, and memories related to trauma. Without proper support and trauma-informed guidance, meditation can trigger flashbacks, overwhelming emotions, and re-traumatization. This is why standard meditation instructions can be harmful for people with PTSD or complex trauma. They need adapted practices with more agency, shorter sessions, eyes-open options, grounding techniques, and therapeutic support. Sitting still for long periods with eyes closed facing your inner experience is not universally healing. For some people, it's re-traumatizing. The dark night of the soul, known in Buddhist traditions as dukkha nanas, or the stages of insight involving suffering, is a well-documented phenomenon in intensive practice. As meditation deepens, practitioners may go through a phase of intense psychological difficulty. Everything seems meaningless. You see the impermanence and unsatisfactoriness of all experience. You feel existential despair. Reality itself seems hollow and terrifying. In traditional contexts, teachers guide students through this phase, reassuring them it's part of the path and will pass. But in Western contexts, where people often practice without qualified guidance, they can get stuck in dark night states for months or years, not understanding what's happening or how to work with it. Spiritual bypassing is using spiritual practice to avoid dealing with psychological issues, relational problems, or responsibilities. I don't need therapy, I meditate. I don't need to work on my anger issues. I just need to be more mindful. I don't need to deal with my childhood trauma, I'll just realize it's all empty. This can prevent genuine healing and growth. Meditation and therapy address different things. Meditation develops attention, equanimity, and insight into the nature of mind. Therapy processes trauma, heals relational wounds, and develops healthy coping strategies. Many people need both. Using one to avoid the other is bypassing. Cognitive and perceptual changes can occur with intensive practice. Some people report difficulty thinking conceptually or making practical decisions. Words start to seem meaningless. Linear thought becomes difficult. For monastics who are fully supported in a community and don't need to manage complex worldly responsibilities, this might be manageable. For people who need to work, maintain relationships, and function in society, it's a problem. Some people report perceptual changes, seeing things shimmering or unstable, hearing sounds differently, feeling like reality is dreamlike. Again, in the right context with proper support, these can be part of deepening practice. Without context or support, they can be frightening and impairing. Who should be particularly careful with meditation? People with current or past psychotic disorders. Meditation can trigger psychotic episodes in vulnerable individuals. People with severe dissociative disorders or depersonalization. Meditation focused on observing experience as object can worsen dissociation. People with active PTSD or recent trauma. Standard meditation can be re-traumatizing without proper adaptation. People with severe depression and suicidal ideation. Some types of meditation can increase rumination and hopelessness. People with substance abuse issues. Meditation can sometimes trigger intense cravings or relapse if used as sole treatment without other support. This doesn't mean these people can never meditate, but they need proper assessment, adapted practices, professional support, and often need to address their primary condition first before adding intensive meditation. A responsible meditation teacher or therapist will screen for these conditions and provide appropriate guidance or referrals. Keep watching, because now we're going to discuss how to practice meditation safely and get the benefits without the risks. So how do you practice safely? First, start small. 10 to 20 minutes a day is plenty for beginners. The idea that more is always better is false and potentially harmful. Your nervous system needs time to adjust to the changes meditation creates. Gradual, consistent practice is safer and more sustainable than jumping into hours of daily practice or week-long retreats without preparation. Second, choose appropriate practices. Not all meditation is the same. Loving-kindness meditation and gratitude practices tend to have fewer adverse effects than intensive concentration or insight practices. Body-based practices need to be adapted if you have trauma history. If you're new to meditation, start with something gentle and supportive like loving-kindness or simple breath awareness. Third, get qualified guidance. This is crucial. A qualified teacher has extensive personal practice, has been trained in a legitimate tradition, understands both the benefits and the risks, can recognize when someone is having difficulties, and knows how to adjust practices for individuals. Apps and books can be helpful as supplements, but they can't replace a real teacher who knows you and can respond to your specific situation. If you're doing intensive practice or retreat, having an experienced teacher present is essential. Fourth, maintain your life. Don't use meditation as an escape from responsibilities, relationships, or necessary personal work. Stay engaged with your life, work, relationships, and community. If meditation is making you withdraw from life rather than engage more skillfully, that's a warning sign. Fifth, integrate with other support. If you're in therapy, tell your therapist you're meditating and communicate about effects. If you have medical conditions, let your doctors know. If you're on psychiatric medication, don't stop without medical supervision just because you're meditating. Meditation can be a complement to other treatments, not always a replacement. Sixth, monitor your functioning. Are you sleeping, eating, maintaining relationships, performing at work, feeling generally stable? If meditation is impairing your functioning in basic life areas, you need to stop or modify your practice and seek support. Meditation should support your life, not undermine it. Seventh, understand the warning signs. If you experience persistent anxiety or panic that's worse than before meditating, increasing dissociation or feeling unreal, worsening depression or suicidal thoughts, difficulty functioning in daily life, scary or disturbing perceptual changes, inability to stop practicing even though it's harming you, these are red flags. Stop or reduce your practice immediately and seek help from a teacher, therapist, or both. Eighth, be honest about your mental health history. If you have or have had psychological conditions, be upfront with teachers and choose practices accordingly. There's no shame in needing to modify practice or take a break. Your mental health is more important than any meditation achievement. Ninth, practice with a community. Practicing in isolation, especially intensive practice, increases risk. Having others around who can notice if you're struggling, who can offer support, and who share the journey, makes practice safer and more sustainable. 10th, remember the purpose. Meditation is meant to reduce suffering and increase wisdom and compassion. If your practice is increasing suffering, making you less compassionate or feeding spiritual pride, something is wrong. The proof of practice is in your life. Are you kinder, more patient, more engaged, more helpful? These are the real measures, not how long you can sit or what experiences you've had. Let me share some cases where things went wrong and what could have prevented it. David attended a 10-day silent Vipassana retreat with no prior meditation experience. By day 4, he was experiencing intense panic attacks and dissociation. He felt like he was going crazy, but the retreat structure discouraged talking to teachers except in brief interviews. He didn't speak up because he thought he was supposed to push through. By day 7, he was in full crisis. He left the retreat early and needed months of therapy to stabilize. What went wrong? No screening for mental health conditions before the retreat. No prior meditation experience before intensive practice. Insufficient teacher access during retreat. Cultural pressure not to quit or speak up. What could have helped? Starting with a shorter retreat or daily practice first. Better screening and preparation. More accessible teachers. Clear permission to modify practice or leave if needed. Sarah had a history of childhood trauma. She started meditating and found it helpful initially. But as she went deeper, she began having flashbacks during meditation. She thought this was supposed to happen, that she was processing trauma. But she was alone with no therapeutic support. The flashbacks became overwhelming. She started avoiding meditation but also felt guilty for quitting. She developed severe anxiety. What went wrong? Trauma survivor practicing without trauma-informed guidance or therapy. Assumption that experiencing trauma during meditation is healing when it can be re-traumatizing. Practicing in isolation without support. What could have helped? Working with a trauma-informed therapist. Using trauma-adapted meditation practices. Having support to process what came up. Understanding that meditation alone isn't trauma treatment. James became very committed to meditation and started practicing several hours a day. He had some powerful experiences, bliss states and feelings of cosmic unity. He became convinced he was enlightened. He quit his job to become a meditation teacher, despite having only practiced for a year. He started teaching others, charging money, and presenting himself as a master. His relationships deteriorated because he was condescending to anyone not as advanced as he believed he was. Eventually, his experiences faded. He crashed into depression and realized he'd been deluded. What went wrong? Spiritual pride, mistaking temporary states for permanent realization, lack of qualified teacher to provide perspective, teaching without adequate training or realization, using meditation to inflate ego rather than transcend it. What could have helped? Having a real teacher who could contextualize his experiences, understanding that genuine realization shows in humility and compassion, not arrogance. More time in practice before trying to teach. Community feedback about his behavior. Have you learned something crucial about practicing safely? Share one thing you'll do differently. And if this is helping you, share this video with others who need this information. Research institutions are finally taking adverse effects seriously. Willoughby Britton's work has inspired more rigorous study. The challenges are numerous. Most meditation research has focused only on benefits, creating publication bias. Retreat centers and teachers sometimes discourage talking about difficulties, creating a culture of silence. The meditation industry has financial incentives to minimize risks. Participants may blame themselves for difficulties rather than recognizing limitations of practice or teaching. But progress is being made. There are now trainings in trauma-sensitive meditation, guidelines for screening retreat participants, better teacher training that includes recognizing and responding to adverse effects, integration of meditation with psychotherapy in ways that respect the scope and limitations of each, more honest conversations in meditation communities about challenges and difficulties. This is healthy. Acknowledging risks doesn't diminish the profound benefits of meditation. It makes practice safer and more effective. Tibetan Buddhism has always had a nuanced view. Meditation is powerful medicine, and like any powerful medicine, it must be used appropriately. The traditional training system with preliminary practices, ethical foundation, study of philosophy, and close relationship with a qualified teacher was designed precisely to prevent the problems we're discussing. When meditation was brought to the West, much of this structure was stripped away to make it more accessible and marketable. What we got was meditation light, practices divorced from their context and safeguards. Some people are now recognizing we need to restore more of the traditional framework, not because it's religious but because it's psychologically wise. The ideal is to learn from both traditional wisdom and modern science. Use the traditional understanding of gradual path, ethical foundation, and teacher guidance. Use modern understanding of trauma, mental health screening, and integration with therapy. Practice meditation as part of a complete life, not as an escape from life. Approach with humility, not ambition. Seek guidance, not just experiences. Measure progress by your character and relationships, not by how many hours you sit. Let me bring this together. Meditation is not risk-free. Research shows approximately 25% of practitioners experience significant adverse effects. These can include anxiety, depression, dissociation, trauma re-experiencing, and in rare cases, psychotic episodes. Tibetan Buddhism has warned about these dangers for centuries, including lung disorders, spiritual pride, and the necessity of proper preparation, teacher guidance, and gradual progression. Certain populations are at higher risk, including those with trauma history, psychotic disorders, dissociative conditions, severe depression, and substance issues. Safe practice requires starting gradually, choosing appropriate practices, getting qualified guidance, maintaining your life and relationships, integrating with other support like therapy, monitoring your functioning, recognizing warning signs, being honest about mental health history, practicing with community, and remembering that the purpose is reducing suffering and increasing compassion, not achieving special states or experiences. When problems arise, they're often due to intensive practice without preparation, lack of teacher guidance, inappropriate practices for individual conditions, spiritual bypassing, or practicing in isolation. These are preventable with proper information and support. The meditation industry has oversold benefits and hidden risks, but responsible teachers and researchers are creating a more honest and helpful conversation. Meditation can be profoundly beneficial. It can reduce stress and anxiety, improve attention and emotional regulation, increase compassion and well-being, support therapy and healing, and deepen wisdom and insight into the nature of mind. But these benefits come from wise, gradual, supported practice, not from blind enthusiasm or intensive practice without proper foundation. The goal of this video isn't to scare you away from meditation. It's to help you practice safely and effectively with realistic expectations and proper support. If meditation were risk-free and universally beneficial in all circumstances for all people, we wouldn't need teachers, traditions, or training. The fact that we do need these things tells us meditation is powerful enough to cause harm as well as benefit. Respect that power. Practice wisely. Get support. Be honest about your experience. And measure your progress not by mystical experiences but by whether you're becoming a kinder, wiser, more compassionate human being. Does this change how you'll approach meditation? Will you seek more guidance or modify your practice? Share your reflections in the comments. These conversations make practice safer for everyone. If you want to continue learning how to practice Tibetan Buddhism wisely and safely, grounded in both tradition and science, subscribe to this channel. We bring you honest teachings that respect both the profound benefits and the real challenges of the path. Click subscribe and turn on notifications. Share this video with meditators, teachers, therapists, or anyone considering starting meditation. This information could prevent serious harm. Informed practice is safe practice, and we need more honesty in the meditation world about both the extraordinary potential and the real risks. I'll close with this. The path of meditation is a path of transformation, and all transformation involves some discomfort and challenge. The question is whether that challenge is productive, leading to growth, or destructive, leading to harm. The difference often comes down to proper guidance, appropriate pacing, adequate support, and honest acknowledgement of both strengths and vulnerabilities. Approach meditation with respect, not just enthusiasm. Seek wisdom, not just experiences. Value your well-being more than any spiritual achievement. And remember, the masters who achieved the deepest realization did so with years of preparation, qualified guidance, strong ethical foundation, and integration with daily life. If you approach meditation this way, you're far more likely to experience the profound benefits and far less likely to encounter serious problems. Practice wisely, live well, and may your meditation serve your own well-being and the well-being of all beings.